A young pregnant woman who's been in a horror accident is about to arrive.
Yeah, g'day George, you're on the VD Consultants for Royal Melbourne Hospital. You're the obstetrics registrar on. So we've got a 31-year-old female who's 37 weeks pregnant. She's been involved in a high-speed motor vehicle accident. The problem we've got is that she's not felt any fetal movements since the accident some time ago.
Kelsey's partner has been notified and is on his way to be with her and their unborn child.
So do we want James and Tessa to have a look at the neonate?
The doctors are trained in a situation like this to look after mum first, and then we look after baby. Often the mothers want it to be the other way around. So Gavin on the airway, and I was going to get Caitlin to do our fast. Yep. Assuming that there is no fetal movement for an hour, that's a really bad sign. That makes me concerned in a significant abdominal trauma that there's been no fetal movements because the baby's deceased. So you'll start out doing a primary. You'll just loiter for a left-sided procedure.
With 2 lives that may need saving, Dr. George has called the obstetrics specialist from the Women's Hospital next door.
No fetal movements felt for some time now. So our main priority will be all about maternal resus. The main role for getting the obstetrician involved early is in case we either need to do resuscitative procedures on the mother, and often that can involve removing the baby immediately. So in the worst case scenario, if we've got a dead mother, then we've got dead baby as well.
Kelsey, my name's James. That's 1, 2, 3.
So this is Kelsey. This afternoon she's been involved in a 2-car MVA. She was the driver. She's wearing her seatbelt correctly, straight under the abdomen and across the chest. She's complaining of lower abdominal tenderness with no fetal movements felt.
Registrar Dr. Caitlin is looking for internal bleeding.
So the first thing we need to do is to look for serious injuries to Kelsey so that we can address those.
So there's no fluid in the right upper quadrant.
The car accident that she's been in at the speed she's been at with the baby at 37 weeks, that would absolutely be a potentially life-threatening situation.
Chest is clear.
Yep.
Air entry and SAT's 96 somewhere in there. She's tachycardic, it's 125. She's got a good blood pressure systolic 120. What we're going to do is do a CT scan of you from head to toe. The reason being is because your heart rate's so high, we want to make sure that there's no life-threatening injuries like bleeding to you.
If I was Kelsey, you would be worried about your health and your baby's health, but also then all of these people around you talking over you, talking about your pregnancy, your baby. I think it would absolutely be very, very overwhelming.
Did you hit your head, lose consciousness?
No, I don't think so. I was just concerned about my baby.
I understand.
Kinds of things we're actually most worried about are injuries to that uterus, to that womb, that can really cause some precipitous troubles for bub. We're just getting that little bit of an ultrasound done. I'm less concerned so much about her going spontaneously into labour than I'm more about her needing to have an emergency caesarean. You know, obviously in this particular case, with absence of movements, we're worried that baby's already had a very bad outcome.
My baby okay?
Best thing we can do for bub is make sure that you remain really well.
Dr. George and the team are desperately looking for signs of life in her unborn baby.
That's placenta.
Obstetrics specialists have stepped in to assist Dr. Caitlin with ultrasound.
Baby's moving. We're just trying to get her heart rate at the moment.
Ultimately, this is about trying to do whatever we can to provide the least risky and the safest possible outcome for both Kelsey and her baby.
There's the heart there. It's just...
Finally, the sound everyone's been desperately hoping for.
Baby's heart rate, Kelsey, can you hear?
Yeah.
That sounds good.
The baby's beating heart. Enormous comfort to the young mum, still hoping her partner Joe is not far away.
There's always a great feeling of relief when you can see that a baby's moving, you can see a heartbeat. As a human looking after another human, you're absolutely happy for them.
What else do we need to get our patient to CT?
Knowing the baby is alive, Dr. George must now get Kelsey scanned for any internal injuries that could put her and her baby's life at risk.
We're going to need to do some CTs of you to try and make sure you remain well.
But with CT scans comes radiation.
People always get really worried. Radiation in my baby, is this going to be really bad? The baby's already potentially cooked. She's just growing and hanging out at the moment. People are always worried if I get radiation, my baby's going to get a birth defect. So I can't tell anybody receiving an X-ray or a CT, or for that matter, any medical intervention, that it's going to be risk-free. Yeah, radiation exposure does represent a cumulative risk, and so we try to minimise it where possible. Yeah, so we'll go to the CT.
With partner Joe still minutes away from the hospital, Kelsey continues to face the terrifying ordeal on her own.
37 weeks, how many days?
4 days, 5 days.
The obstetrics team returned to the women's hospital without having to perform an emergency caesarean.
Just like wear my seatbelt.
You've just decelerated into a seatbelt. It's going to hurt. And now their heart rate's 130. How much pain's the right amount of pain? I don't know. So we investigate further. I guess we could just sit in our hands and see what happens, but by the time something bad happens, it might be too late for the baby or potentially even for the mother. Just think, in a couple of weeks' time, you won't have to be sleeping on your side anymore.
Well, Thursday I was booked in for a Caesar.
Thursday?
In CT, 37 weeks pregnant Kelsey is about to be scanned after having a high-speed car crash.
What's the bub's name going to be?
Polly.
Polly. Ready, set, go.
Dr. George is looking for injuries to the young mum and her unborn baby.
Your heart rate's 130 post a trauma after 90 minutes. That's not normal. You got a seatbelt sign on your neck, a seatbelt sign on your abdomen. So we do a CT and we're looking to try and exclude any nasty injuries to the mother. But even if the CT is normal and doesn't show us any injuries, that doesn't absolutely get us out of the woods yet. So we know in this group of patients that they can have significant injuries to the placenta or to the uterus that we're just not going to see on the CT. Because if she were to have some of those injuries, well, then we'd need to intervene and perform an emergency Caesar and get the baby out of there. But fingers crossed it doesn't come to that. So we'll get you off the table onto a more comfy bed, get you back, and start doing some of that, CTG monitoring. We would at the very least be keeping her for a few hours and most likely overnight to keep an eye on things and make sure that she remains stable.
Partner Joe is finally here to comfort Kelsey.
Where's my partner? Can he come in?
Yeah, follow it.
Kelsey's a great mum. She's amazing. I think about her every day. There's not a day goes by I don't think about her. And all we want is to have a family and just have a normal life.
All right, Polly's okay.
Done the CT scans and we can't see any significant injuries to Kelsey or, thankfully to her baby either. So that's really reassuring information. So from here, the trauma team can touch base with her tomorrow to make sure that she's remained well overnight.
Kelsey and Joe share an enormous rush of relief. The worst is past.
Are you scared, Joe?
I was scared.
31-year-old Kelsey was 37 weeks pregnant when she had a major car accident.
My baby okay?
Baby's heart rate, Kelsey, can you hear?
Yeah.
Okay, that sounds good.
Fortunately, CT scans didn't reveal any major internal injuries.
Yeah, the baby's moving and the baby's got a pulse, but we don't know what that baby's going to be delivered like.
Kelsey was transferred to the Royal Women's Hospital and closely monitored. Thankfully, a beautiful, healthy little girl was born 2 days later. Baby Polly is thriving, receiving lots of loving care from Mum Kelsey, Dad Joe, and big sister Isla.
So we have Joe, myself, Isla, our 5-year-old. We have Polly, who's now 9 weeks old. And then we have our 2 dogs, Louie and Vega. Polly is perfect. She just is such a dream baby. 4 kilos of perfectness. Born she was. Isla is obsessed with Polly. Yeah, she's just the best big sister.
I feel very blessed that everything was okay and that we can all be here today. I think I'll be thankful every day I'm alive, I think.
She's, completed our family.